Well, hey everybody, we're here today at Mayo Clinic Square, home of Mayo Clinic Sports Medicine and the new Timberwolves and Lynx practice facilities. Let's have a look around. Hey Richard, good to see you.
Good morning, Hoyt.
All right, it's a great looking space.
Thank you. Yeah, we feel very fortunate to have the space that we do here at Mayo Clinic Square in Minneapolis. One of the highlights of this space is our concierge, Ian here. And so Ian's role is, as you would think, as a concierge, helping our guests feel welcome. The other part that's really important about Ian's role is connecting our patients to Mayo Clinic Rochester as well. So as you know, here at this space, our focus is orthopedics and sports medicine. People know Mayo Clinic for more than that, and so if we need to connect our patients to Rochester, part of Ian's role is to help that access be easier for our patients. So an important part of what we're doing here in Minneapolis. So Hoyt, in this space here, we're highlighting our collaborations and partnerships with various pro elite teams here in the Twin Cities. So we do provide care as team medical providers for these teams. Part of what Mayo Clinic's doing here in the Twin Cities is really expanding the scope of our care. And so we have our clinical care that Mayo's had for 150 years, and we brought that together in a collaboration with Exos, a world leader in performance training, so we can take care of athletes both when they're having injuries and dealing with recovery, as well as when they want to get at the top of their game. This is our exam room. So here at Mayo Clinic Square, we have 7 clinical exam rooms that our physicians, our therapists, our trainers, and dietitians use to take care of patients. One piece that's unique about this space is because we are an academic medical institution, we have residents, fellows, students, and learners here alongside our care providers. So Hoyt, the next clinical space we have here is our procedure suite. So in this procedure suite, we perform regenerative medicine procedures. These procedures include things like PRP, bone marrow stem cell, and other biologic injections. A huge part of sports medicine and orthopedics right now is using your body to help itself heal. So Hoyt, in this space is our digital radiography. None of us tend to be very patient, but athletes in particular want to know if they get hurt on Monday, can they play on a game on Tuesday? And so imperative for us to have on site the ability to look at bony issues. And so Hoyt, we've now entered the radiology space, our MRI suite here at Mayo Clinic Square. I want to introduce you to Dr. Adam Johnson, our on-site musculoskeletal fellowship trained radiologist. Dr. Johnson, can you tell us a little bit about our space here?
Yeah, so when we opened, we have one of the new GE 3 Tesla magnets. It's one of the strongest magnets in the city. It's also a large bore magnet. One of the unique features I've noticed is that we have a very collaborative way that we work together. We have clinicians on site who come and have a patient scanned same day. They can come back and we talk about the results and discuss what possible treatments might be beneficial to the patient.
So in this space, Hoyt, we have our laboratory, and so one of the unique pieces of what we're bringing to patients here in the Twin Cities area is a one-stop shop for sports medicine clinical services. And so, you know, they can see their physician, they can get an MRI or an X-ray, they can have a procedure done, and they can have lab work done. In this space, we have our open treatment area, so we can use laser, ultrasound, heat, all the latest state-of-the-art equipment to help tissues heal quicker in a group setting, and so it's going to be familiar to any athlete who's been in a training room before. One of the unique features of this space is its connection to our turf area, and so as an athlete you can imagine there's a challenge when your identity is really tied to being an athlete and you're not where you want to be in your performance. You've gone through an injury, maybe you just had surgery, so we wanted to connect the athlete to the active space in the turf, saying this is where you are today, but this is where we're going to help you get back to. So we've now just entered our turf space, and so this is a very important piece of what we're doing. To have 40 yards of artificial grass in the middle of downtown Minneapolis is essential to help our athletes. And so, as you can imagine, athletes want authenticity of space. So if they're a turf athlete, they want to be running on turf. If they're a court athlete, they want to be on the courts. In this space, what we'll do is both clinical care as well as our performance care with our Exos colleagues. And so in the space here, we'll videotape athletes as they're performing their sport, kicking a ball, hitting a ball, swinging the golf clubs. We'll videotape it with high-speed cameras, and then we break it down with our athlete. So Hoyt, one of the unique parts of our relationship with the Timberwolves and Lynx is the medical provider. Another very important piece is shared equipment and shared facilities. You can imagine a pro elite athlete wants access and has access to the best state-of-the-art equipment. part of our relationship allows us to share equipment. And so beside us here, we have 1,200 square feet where we're putting a number of pieces of equipment together so that their athletes, the pro athlete, can use them as well as our athletes.
We're fortunate enough to have a relationship with a company called Kaiser, which provides a lot of our state-of-the-art strength training equipment. What's unique about the Kaiser equipment is that it's air-powered as opposed to traditional weight plates, which are gravitational resistance. So we can have our athletes go and perform very dynamic, explosive movements on this, and the air provides constant resistance throughout the range of motion. We also get readouts for our athletes' power and their current percentage of whatever their peak power is. A major component to what we do here at Exos in partnership with Mayo is our nutrition. At Exos we have 4 pillars we talk about: mindset, movement, nutrition, and recovery. And this is a gap we most often find in our athletes. We have a sports dietitian on staff. She'll bring our athletes in, they'll get a body composition assessment, and just some general daily outlines as to what good nutrition looks like.
Welcome to the courts at Mayo Clinic Square,
Wow.
home of the Minnesota Lynx and
Very
the
cool.
Minnesota Timberwolves.
Hey,
Uh-oh.
it's Mayo Clinic spokesperson John Murphy.
Hey Rich, hey Hoyt.
What are you doing here, John?
Gearing up for the NBA draft. Also, here touring the space. This is a great idea of collaboration between the Timberwolves and the Lynx and Mayo Clinic, and it allows great access for our patients to Mayo Clinic.
I want to introduce you today to Dr. Nancy Cummings.
Dr. Cummings?
Hi there.
Dr. Cummings is a team orthopedist for the Minnesota Lynx and our orthopedic surgeon here at Mayo Clinic Square in Minneapolis.
Okay. Well, tell me about your role with the Lynx.
Well, I'm the orthopedic team physician for the Minnesota Lynx. Because of our collaboration, my office is right next door, so I get to come over and watch practice when I'm available. If somebody gets injured, I can scoot right over
Right
and help
there.
them out.
Okay. How does being here all together help that role?
Well, it gives them a fully integrated care system to bring the Mayo Clinic care system of multidisciplinary integrated care to the professional athletes here.
So, John, you're going to work on your shot a little bit here? Or?
You bet I am, Hoyt.
Okay. Wow, I'm ready for this.